In describing childhood apraxia of speech, I've mentioned movement transitions and how for articulatory configurations or movement transitions, awkward movement transitions are seen in children with CAS. What does that mean? Well, let's start with the rationale of why are we even looking at movement transitions. We want to understand the movements that are associated with producing sounds, syllables, and words. And remember the example of boy versus, I think it was B, boy versus B, and how movement of the lips for those words varies so greatly depending on what the next sound is going to be. And so movements are focusing on movement is an important component of smooth and fluent and accurate speech. So we want to get a sense of whether the movement transition is smooth and if there's any evidence of a sound addition, a sound deletion, any kind of segmentation. Remember the example I've given you in the past, for by. It's almost as if there is a segmentation in there, maybe a slight insertion, and slowing the word down a bit. So those are all examples of a poor articulatory transition as the child moves from simply that consonant into the vowel. We're also looking at whether there is any articulatory groping or struggle to produce the sound. So you can examine movement transitions in any production at all. In a syllable sequencing task, there are some tasks where kids are asked to produce sequences of vowels like ah, ooh, or ah, e. We can look at that transition there. In our diadochokinesis, diadochokinetic tasks, we can also look at sound sequencing as you're going through those movement tasks, like especially with the words putticup or buttercup. We also can do that in the SRT that we just talked about, using those non-words as part of the SRT to examine whether there are some smooth movement transitions. But keeping in mind that example of by is a good one where we can even look within single syllable words to examine that transition between uh, consonants and vowels. And of course, we look for the transition, we examine the smoothness of movement transitions in connected speech as well. So we can look in varied speaking contexts, and we're looking for that level of a breakdown. There could be an older child with CAS who's had therapy for a while, and their movement transitions for single syllable words or short phrases might be okay. We may only see this breakdown in connected speech. Again, supports the point of we need to examine multiple speaking contexts when we're examining speech in kids. So this information will help differential diagnosis and guide treatment planning. And we want to, as we're looking at movement transitions, think about how we might be taxing the child's system. Taxing the system simply means that we are pushing the child beyond what they might naturally give us. Recall that I've said that children with limited verbal output might not give us a lot. They might produce single syllable words, simple CVs with a couple phonemes. When we ask them to produce a range of speaking tasks, like the SRT, where there's simple phonemes combined with the same vowel, but they're going to be asked to string words along, string syllables along until they get to be longer and longer strings. That's taxing the child to go beyond a single syllable production. We can alter place of artic, as you see here. Pataka is an example of all these sounds are plosives. The vowel is the same, but the plosives vary by place. We could alter a manner of articulation by including segments in combination that represent different manners of articulation. In this case, P is a plosive and N is a nasal. And then we could also alter vowel characteristics using your vowel quadrilateral as a guide so the child has to combine vowels that are produced across the vowel quadrilateral. the main point here is that we come up with tasks to tax the child system so that we could see how what kinds of productions they might um, give us and what they how they might attempt those more challenging productions, and the output can play a really big role in differential diagnosis, distinguishing between a more common phonological impairment with dysarthria and with childhood of speech. So again, last plug for the SRT. It's a useful tool if we're looking at movement transitions in kids, and easy tool to use.